Cassidy, and no, she's not going to be in pain. It's going to be lower leg pain, and really what it's going to be a subluxation of the tibiofibular joint. So in the lower extremity here, you have the biggest bone in the body, which is the femur. You got the big bone that stabilizes the lower extremity, which is the tibia. And then you got this floater bone here that moves superior and inferiorly when she's walking, when you're walking. And of course we have the patella here, which helps guide the tendon and the muscles in a linear fashion. So here's the tricky thing is this. When the tib-fib joint is subluxated, the oddity is that she could squat 1,000 pounds. And no, she can't squat 1,000 pounds, but I'm just saying in a reference. She could probably leg press 500, but it hurts her when she walks 5 feet. So I'm going to show you how to correct the tib-fib joint, which is very, very common that a lot of people have overseen. Okay, so the thing about the knee is that, and what's unusual about this joint here, is because the knee, it's not like a hinge joint like your elbow. The knee actually has a rotational factor. So when she extends the knee out, there's actually a rotational. And this is why, like I said before, she could squat a lot of weight. She could stand and bend her knees with a lot of weight on it. However, she can't walk more than 5 feet because you do have the rotational factor here that when you have the femur, the patella, the tibia, and the fibula, the fibularis bone. Now remember, the function of the fibularis bone is when she is walking, when you're walking, it does help support the ankle, and in addition to the tibia, but also to the gliding motion of the patella. So when she's walking and it's out, this is where the pain becomes because it wants to go superior, but it can't. Now with the fibula, the proximal fibular head, it likes to hug around the tibia. So it's either going to be subluxated either anteriorly, forward, or posteriorly, backwards. Now the catch is, because where the pain comes from, the sciatic nerve, which is the biggest nerve of the body, that comes from her sacrum to her hamstring, it bifurcates in the back of the knee. So you have one anterior division that comes through here that wraps around the fibular head, that supplies an innervation to the anterior muscles, and you have a posterior division which stays in the back of the knee and innervates the posterior muscles of the lower extremities, and it wraps around the foot. So this is where the pain comes from, because remember, if it's subluxated, and every time she walks with that rotational factor, like a screw, this is where she's going to get pinched. In addition to, a lot of these anterior tibialis muscles here, they're going to be in a state of spasm because what it wants to do, it wants to secure the knee while this is subluxated. Okay, so when she's on her stomach, now there's two different ways that this is going to be displaced. Is it going to be displaced anteriorly or posteriorly? Okay, so with the adjustment, I've already got the distal end when I adjusted the ankle. So let's say that it was displaced posteriorly. So where does it have to go? Anterior. So with this toggle board, you get it, and I'll place it probably about like an inch below, wherever because I can palpate the fibular head, and then I go about an inch below. Okay, because what you want to avoid having the toggle board too high because you don't want to adjust her patella. And they'll tell you when you did it wrong. So you adjust the tension accordingly. I'm going to, with one hand, distract, grab the ankle, distract it just slightly. You're not going to, your focus is not to pull them off the table. You just want to stretch it out a little bit because you want those mechanoreceptors to be stimulated. And then it's not a hard adjustment. You just come, and again, 3 times. Because I want it to go posterior to anteriorly. You could palpate it, and they will tell you. They will tell you, the good thing about this adjustment, it's immediate gratification. They know immediately that it feels good. And if you want to play around with it a little bit, like bend the knee a little bit, because remember the rotational factor, this is a very good adjustment. So what if it is displaced anteriorly? That's going to be a different position. So let's have you turn over. So I know she just flipped over, so left is right, right is left, because I want to show with the angle, with the camera angle. So let's say it's displaced anteriorly. Now, when it's displaced, either if it's displaced anterior or posteriorly, you're going to have a lot of adhesions and tightness in the calf muscle as well, the anterior tibialis muscle. So, and you could feel it when you're going back and forth dorsiflexion, plantar flexion, and just palpate down the tib anterior muscle. You could feel it. There's like right here, there's a little bit of a stoppage right here, because her mechanics were thrown off, so she was compensating. Now there's a couple things you could do. Either if you have good, nice, strong thumbs, you could just kind of rub, just do like a little bit of a massage on her anterior tibialis muscle, which is going to hurt. It's going to hurt because, again, you're breaking up all these adhesions. Or there's different things you could do. I have a little like a vibration, like a prong vibration gun, that I just go down the tib anterior muscle just to break up the adhesions as well. So let's get back here. So let's say it's displaced anterior. And also, always adjust the ankles. Always adjust the navicular bone. Always adjust the talocrural joint, because you want that range of motion here. Same thing. You want to stabilize it. Strong dorsiflexion. And then with one hand, it's anterior, so again, it's just a little whack. It's like a whack-a-mole. There you go. And two, once that's moving and in place, it's immediate gratification because of the rotational factor. Okay, so I hope this helps. If you like the video, please share it. If this sounds like something that's going on with you, please give us a call, 630-653-2225, or you can always go to the website, www.totalhealthdupage.com. Thank you very much. Thanks for watching. Be good.